My name is Eric Lederhaus. I am a physical therapist with ARC Running, and alongside me is Joshua Grubb. He is a running coach, and we work together to help runners overcome injuries and train more efficiently. Today, we'll be talking about hamstring pain, and I have dealt personally with this, as well as some runners that I currently help. So we're going to be talking about the hamstring anatomy, its function, and the type of injuries that result from that, as well as understanding the stages of healing for hamstring injury and exercise progression, how to manage it. So a very typical thing I see with my runners is, hey, I'm doing wonderful. I've been running for a while, and I started to do tempo runs or sprint workouts. And all of a sudden, I felt a pop in the back of my leg or some just achy pain back there, and it was horrible. So the question that comes is, how long does it take to heal? What do I do? And when can I run again? A lot of runners, including myself, tend to be pretty stubborn and running through injuries, and this injury can be very stubborn if not treated well. So I like trivia, and it's interesting to note the word ham is derived from the Old English ham or ham, meaning pretty much the bend of the knee. And it was pretty much associated with pigs because they used to hang pigs by that muscle. So we have hamstrings as naming that muscle and kind of stuck. So the hamstring muscle, there's three main big ones. We got two on the inside and one on the outside. So where it starts is on your sit bone. It's called the ischial tuberosity. It's underneath the glute. Now, this common origin goes down, I'll go to this side, for the semitendinosus and membranosus, and on the outside is the bicep femoris. So it's a two-joint muscle. It crosses the pelvis, which is the hip, and then the knee joint. So it works actually extra hard, more than most muscles, because a lot of muscles are just one joint. In terms of just straight up function, it's knee flexion, where you bend your knee, and or hip extension as well. So on the left is knee flexion, where you bring your knee up, and on the right, your hip goes back. So that's the anatomy. And the type of injuries we see with the hamstring are really two types. We got the acute pain, which is the one I described earlier, which is much more common. It's a sharp pulling sensation that you feel in the back of your thigh. Personally, I've had that playing soccer, where I felt a pop and I could barely walk. And I tried to recover for a few weeks and continue playing after a few weeks, and I re-injured it again. More chronic proximal hamstring tendinopathies, that's a little bit more nebulous, a little bit more difficult sometimes for patients to treat, because that's more at the insertion near the pelvis. And so people feel maybe a deep glute kind of pain. That one's a little bit more stubborn, if you will. So in terms of another function the hamstring does, in terms of an active way with running, so we see this kind of quick diagram where you got initial contact going through mid stance and takeoff. And on the right side, that's when your leg's in the air. Your hamstring, as your leg is going to terminal swing, if you remember, it connects from the pelvis to the back of the leg. It actually controls the bottom leg, the tibia, from going too far forward. So it's called the eccentric load, meaning it's being stretched out, but it's still being used to control that. So it's not shortening, it's lengthening, but in a controlled way. So for the tibia from not going too far forward and falling and overstriding, stuff like that. This is probably a better picture for you to appreciate that. So we have again, two joint muscle. Here's the ischial tuberosity, which is behind the hip, and then going down past the leg. So it's controlling this bone from going too far forward. And I hope you can imagine if this was a string, it would keep stretching if the leg continues to go out. So with that being said, the most common way for the acute injury is usually in a sprinting or repeated hills where the hamstring is really being pushed, and you get that eccentric overload. So it's a stretching overload where you get some micro tears in the tissue. And if you don't train it properly with proper lengthening and strength of that tissue, you'll be more vulnerable to your higher end runs. From my experience and others too, if you don't treat it properly, there's a high risk of re-injury. Grade 1 is the kind of mild to no loss of strength, low-grade inflammation. So it's that mild pull, and you feel some achiness and maybe take a week or two off. So it's not too threatening. Grade 2 is that partial incomplete tear. Again, that's a little bit more painful, more acute pain, some edema, some bruising in that area. And so that takes a little more time to recover. And of course, complete rupture disruption there's a complete loss of function and of course, high pain and issues there. So that's of course surgical and long recovery for that. But generally speaking, it's grade 1 to 2. The more visual representation, grade 1, you got the micro tears in the hamstring. So it's kind of some redness, maybe some very mild swelling, but nothing too bad. Grade 2, partial tear, and grade 3, a full tear of the hamstring. So clinically, what we see, and it's not actually necessarily right away, but we do see bruising along the hamstring muscle. For example, I hurt mine and I didn't feel bruising for a day or two. So it's a little bit delayed, meaning there's been trauma induced to the hamstring tissue and, there's blood coming out. If you have a big bruising, some people don't feel a lot of pain, but just have a lot of bruising. It doesn't necessarily mean there's a big injury if shows more bruising. It's just the way it is sometimes. So the chronic injury near the insertion where the hamstring arrives in the sit bone, that is, again, a little trickier to treat because it could be a little more nebulous for pain. So usually people have this, hey, I don't remember what happened, it just started to come on. They might feel tightening or cramping in the hamstring muscle or the posterior glute as well. But I've seen people be treated for back issues when the issue is actually the proximal hamstring disruption. Healing time is extremely important with any injury. That dictates really how you can load it and when to get back to running. So all tissues go through a series of stages to heal, inflammation being the first one, the reparative phase, and the remodeling phase. The inflammatory phase is about a week. It could be less or more depending on how you treat it, but usually it's more redness, higher pain. And I say don't run in this phase. Runners are pretty stubborn when it comes to their training routine. They want to stick to the schedule no matter what because they think they're going to lose cardio endurance or their plan, and the injury just gets worse and worse. So for me as a physical therapist, I say, hey, the pain trumps the schedule. Let's deal with the pain so you don't have this chronic issue and not limping to the start line. The reparative phase is where the tissue is getting stronger. So there's less pain. It can take more load. So you might notice it's less painful to squat and walk around, stuff like that. So you're feeling pretty good. And at this phase is where it's fragile, though getting stronger, but a lot of runners tend to overdo it here. So they think they can go back. Like myself, I played soccer, hurt myself, and went back a few weeks later and re-injured it again. So I was feeling good, but when push come to shove, I restrained it because it wasn't strong enough. Towards the end of the reparative phase, depending on how the pain is and all that, I consider a walk-run to start reloading gradually, not getting right back into the routine because we want to see how the tissue responds. And after about a few weeks, the inflammation goes down, reparative phase comes up, and so it's all kind of in an overlapping sequence, if you will. So the remodeling phase is the tissue is much stronger and you can push it more. So you might do squat jumps, start to get more sprinting, stuff like that. And that takes some time. And again, listen to the body and how it's doing with the load. If there's pain, that's your friend. It's telling you what you can and can't tolerate. So please listen to that. You can just see the overlapping phases. So it's not strict. After 1 week, I'm done. And then you go to the next phase. Listen to the symptoms, see how the tissue is responding to load, and you kind of push from there. Just to note, I see a lot of recurrent injuries with runners and people in general. They tend not to strengthen well. So they might get stuck in the reparative phase and not really strengthen the tissue for more resilience. So just know that strength is very important for the hamstring. When people hurt themselves initially, you get this pain response, and there might be some muscle tone or the muscle feels tight. And the first thing people tend to do is want to stretch it out. It makes sense because you want to do something to help this pain. But if you think about it, the hamstring was overloaded via aggressive stretch, if you will. So you potentially even tore some of the fibers by overloading it. And so I tell my runners, don't stretch it. Unload it. We can do some muscle pumping action. I'll show you some exercise in a moment. But I avoid usually stretching the first week or two, just so it can heal and you're not pushing that scar too much. These are a few exercises I give my runners. So the phase one, and we have, by the way, a phase system for the hamstrings that's more detailed in our pathway system. But for phase one, you want to reduce inflammation, the pain as best you can. You want to get back to the reparative phase sooner rather than later. So I have them do like heel digs, for example. If it's high pain, just pumping the tissue a little bit. I say don't go above a 3 out of 10 pain, but just get some muscle activation and relax. To no fault of people's own, they tend to just stop completely any activity, which is good for a moment, but if it's prolonged, you just kind of letting the inflammation pool and the tissue's getting weaker. And so you need a little bit of stimulus to get strong again. With time, they do a pro knee flexion, just again to pump the muscle. You can use resistance some. If there's high pain, no resistance. Get the inflammation out, get the pain down, and we can go on to more gradually loading exercises. So the second phase, the reparative phase, is you begin reloading. So usually a common one is bridges on the left, in the middle of some squats, just to see how it feels. What I tell my clients is I don't want pain greater than 3 out of 10 and no lingering pain. Meaning if you do the exercise and it's there the next day or later, it means you push it a little bit too hard. Some pain's okay. Again, there's a lot of modifications you can make on the bridges and the squats. For squats, I don't have them go as far down. They might be being a squat with the ball against the wall to begin the loading process, but again, not overloading it. And of course, split squats get more demanding. There's Bulgarian split squats, there's step ups, there's squat jumps for that progression. So when the reloading phase happens, when you get into this remodeling phase, the stronger tissue, you can really push it. So I like deadlifts. I like single leg deadlifts because it's eccentrically loading the tissue. And that's, if you remember from the terminal swing, that eccentric load on the hamstring. I do like step ups for hills and squat jumps for a more plyometric load to the hamstring. And again, at this point, you shouldn't have really any pain at all, more just weakness. Among other things, like strengthening the glutes is wonderful for the hamstrings to help support it. Increasing your hip flexor length, because that puts less strain on the hamstring as well. For a stretch is wonderful. Strengthening your core helps support the system. So when I say these exercises, I am referencing the hamstring, but know there's a lot that helps support that system as well.